speed as far as how we can help.
I'm Barb Myers, and I most recently was one of the telephone answering people and appointment setting. I have worked as a navigator, and we had a little office here. I live in Cookeville, Tennessee, which is in Putnam County. We had an office here for the very first couple of years, and got a lot of people enrolled that way, and have been helping in whatever way I can for the last umpty-dump years. So, John, who are you?
Okay, I'm John Richardson. And I've lived in Sevier County, and I've worked primarily with Rich Hennigan doing enrollments. I've also done the 844 line 1 year, but just looking forward to seeing how we can help this year. I'm not a CAC. I've just always worked with Rich pretty close by, so I could toss a question to him when there was something that I didn't understand or needed assistance with. But we'll just see how it goes this year. I've got a satellite internet connection, and it's real sketchy at times. So I'm not sure how my audio is coming through. I can generally hear people, but it breaks up from time to time. Some days we get pretty good on Zoom meetings. Other days it's kind of in and out, and that's real dependent on the weather. It looks like things might be getting a little dicey as far as the weather goes here. So we'll see how it lasts. But
hey, John.
Anyway, good to see you all.
John, if you have a problem with that, if you turn off your video, you won't use as much bandwidth, and it tends to come through clear.
Well, let me try that.
Anybody else want to do an introduction, or should we just start?
We'll see how that does.
Sure. I'm Joe Marcus. I've been a navigator since inception in North Carolina. I just moved to Tennessee last year, and so here in Chattanooga, I'm still kind of trying to figure out how I can fit into the efforts here. I certainly will continue to go through the training every year, so I'm up to date with what HHS wants us to do. So I'm just here to see what's going on and see how I can best help.
So this is Rich Hennigan, and I'm in Sevier County as well. We're pretty close to Knoxville. And I'm hearing an echo. Are others hearing an echo?
I'm hearing an echo also.
Wonder what's
I'm gonna mute everyone whenever I get started.
Okay, and I've sort of played a leadership role in enrollment in Sevier and Blount County the last several years, and I've been involved with enrollments in the whole area here since the beginning. I've been a CAC for, I don't know, 4 or 5 years, maybe longer, and will intends to re-up it as long as I can. I'm able to do that, and I still have a slow trickle of referrals from the senior center in Sevier County. That's one of the sites where we used to have face-to-face enrollments, and the director there relies on me particularly, but also the other people who've helped me to help people that come in that she is helping. She does Medicare, but she has not learned the ACA well enough. She thinks she's happy to have me around. So I get a call once or twice a month to help her with the family. So I've done several online enrollments this summer, using FaceTime, and I'm trying to learn the best practices for doing that. I wish FaceTime had a simple way to share your screen, but it doesn't that I can tell. There's apparently a way, but it seemed pretty complicated to me, but that's enough for now.
All right, you guys want me to get started?
There's a bunch of people on here. Let's see. I mean, I guess we can invite anybody else who wants to speak up and then see what happens.
All right, well, anybody want to speak up?
Jackie,
You got to unmute yourself, Jackie.
Hey, Jackie.
unmute.
I talked to a lot of you on the phone. I've been doing this a while. This is my face. Look forward to working with you this coming year.
And Jackie's in Nashville, so.
Yes, Nashville, thank you. I've been doing TennCare as long as I've been doing Marketplace, and that has worked out very well with the people at TennCare. So we were able to solve a lot of problems that way.
Jonathan, do you want to introduce yourself?
Two thumbs up. Oh, I don't think we can hear him.
Okay, we can't hear Jonathan. He does a lot of work at Lentz, is very good at TennCare as well as the Marketplace. He's been doing it a long time, and he's working a lot with the people who are on TennCare to get him some extra help. So that's useful as well in this area.
Wonderful. Okay, I'm going to go ahead and
Oh,
Mike busted.
Anne, just real quick.
oh,
There, unmute. Where am I?
you're unmuted.
Okay, I'm Ann Lucas. I no longer do enrollment, but I do work on the hotline, and I'm looking forward to doing that again this year. That's it.
Perfect. Okay. And I'm going to mute everybody for just a minute. I'm going to allow you to unmute yourself. My name's Andrew Hawkins. I have been doing this since 2014. I actually started in 2013 as a volunteer, and then I came on as a CAC, and then got promoted to a navigator, and now technically I'm an insurance agent, but I work for the Tennessee Healthcare Campaign. So I've kind of done all fields and sides of it, and also with Medicaid and stuff like that. I'm really excited about this year because this will be the first year that the Healthcare Campaign can gain financial compensation from the insurance companies for the work that we do. All right, let me get the PowerPoint up. Just 1 second. If I can get this thing to share screen. And I want to share this. There we go. Can everybody see that if you just nod your head? All right. Well, you guys are in my way. Sorry, just bear with me just a moment. There we go. Okay, here we go. And this is just my intro page. Let me get this screen up. Oh, we got someone else coming in. There's Meryl. All right, so this is it, and this is the OE8, which is Open Enrollment 8, THCC Enrollment 2021. The program is Insure All Tennessee, which is a new program that we're doing as part of the having agents, as part of, you know, helping us get compensation from the insurance companies. Now this is my way. Okay, these are all the trainings I'm going to be doing up until open enrollment. I'll probably throw a couple more in here, but the first one you see, Introduction to Health Sherpa, because Health Sherpa is the system that we're going to be using this year primarily, unless you really want to use healthcare.gov, then do it. But the reason why we want to use Health Sherpa is because if a volunteer does an enrollment on Health Sherpa, it has me as the acting agent on the account. Therefore, the Tennessee Healthcare Campaign gets compensation for that work. And also, I'll go into more of this later, but you will tell them Andrew is going to be your acting agent for, like, let's say they pick a Cigna plan. Well, Andrew will be your acting agent. So I will take on the responsibility if they don't have it with them or you don't feel comfortable doing it, uploading documents, making sure they pay their bill, sending out reminders. I will take on all of that. But that'll be an introduction to Health Sherpa. I just want to get that at the very beginning. And then I have a volunteer trainings, and those are just, I'm going to go over, because we have 5 different volunteer things that you can do this year. So I'm going to do trainings on those to show what's going to go into each one of those. And I put those on 2 different times. You can see on Thursday, I do one at 10 and one at 6. Then I have an overview of the connector on October 6th. And on that, we will just go over the connector again to show you how to use it. And then introduction to phone appointments. Those are 2 different days at 2 different times. I'm going to go through how to do a phone appointment enrollment. And using Health Sherpa, it's a whole lot easier because you don't have to create an account and remember a password or anything like that. So that is the best benefit of Health Sherpa, is not having the password problem. Then I'm going to review of Health Sherpa. That's right before open enrollment. I'm do that on 2 different days. And then we'll have everybody coming together on the 29th and being ready for day 1 of open enrollment. All right, these were just our numbers from last year, so we're always going to try to beat that. Last year we enrolled 3,040 people into health insurance or TennCare. This year it's a little bit slower right now, but I think we can beat it. We'll just have to see. If TennCare pausing their redeterminations has really affected our TennCare enrollment. All right, new volunteer opportunities for OE8. And here they are. There's 844 call volunteers, and those are the people that are going to answer the 844. I'm going to try not to do any answering on the 844 this year, unless we really need me to do it. So we're going to kind of have just volunteers doing that this year, which would be completely different. We're going to have pre-enrollment assistance. I'm going to go over all these individually. Outreach volunteers, enrollment assistance volunteers or CACs, and post-enrollment assistance volunteers. When I send you this PDF, you can actually click the register to volunteer, and you can sign up for which one you want to do. And you can sign up for multiple ones if you want to do more than one. All right, this is the 844 calls volunteer. And this says they will just answer the 844 line during designated time that they're willing to participate. They'll help determine the caller's eligibility into Obamacare or TennCare. They'll assist people in the gap. I have options. Hold on, I think someone's chiming in. Well, they'll just have to not get it. We have options to cover RX and different features like that. I can help you find a sliding scale clinic. I have all that on Google, and you'll be able to use it. And see, at the bottom it says resources will be available on the Google form for that when people call. And so it'll come directly to your phone line. If you've done the 844, you're familiar with all that. But this year, I'm going to have all the resources on one page. So it's just answer the call and use the computer as resources. That's all you're going to have to do. I don't need any like data tracking off that. There's pre-enrollment assistance. This is a new category. This one is going to be we had a problem with every year with people not showing up for appointments, especially when you do phone appointments. It's hard for people to remember that they have a call next week at 10 o'clock in the morning. So what we're going to do is we're going to have people that can do pre-enrollment assistance. And what they're going to do is they're going to call them a day or 2 before the appointment, and they're going to go over what the appointment's going to be like. They're going to tell them all the details that they're going to need. They're going to make sure they're ready, make sure that they know that they're going to need. Hold on. They know that they're going to need birthdays and socials for everybody, and just make sure they're prepared for the appointment, because I just think that if we can get the people in the mindset, especially with phone appointments, there's going to have to be a reminder. Another one. There's going to have to be a reminder before the appointment actually starts. All right. I'll pause this in a minute for questions, just so. This is an outreach volunteer. And for the outreach volunteers, we're just going to ask you if you can frequently create posts to Facebook and Twitter about enrollment events or phone enrollment opportunities. We want you to be creative and create flyers about our work. Reach out to newspapers, radio stations, and other opportunities like that. Maybe health council meetings and different stuff like that where you can reach out to people. We really need this group to do the navigator work. We need the volunteers to do the outreach, because that's what we lacked last year because we lost the navigators in July. And just says be creative to find new ways to promote Insure All Tennessee and communicate with community members about promoting our work. All right, enrollment assistance. This is just the CACs. We kind of want everyone to become a CAC, but I'm not going to say you can't do it if you don't get it. The idea of it is that we really want, especially if you're going to do phone enrollment assistance, I really need you to become a CAC, because every enrollment you do, if we're using Health Sherpa, will have my name attached to it. So I'm going to be a little responsible for the work that you're doing, so I want you to be trained and certified. But as you can see, we also need, if we are able to have in-person assistance, we do need other people that do other things like greeters and, just people that can, just different places, different groups of volunteers do things different ways. I know Chattanooga does things a different way than Knoxville, than Nashville, and everywhere. So we'll always need more volunteers in person if we're able to have it. But we don't want any volunteer that would feel uncomfortable volunteering during this time because of COVID. In fact, we're going to have our volunteers sign a waiver that if you get sick, you can't sue us over it. So we really don't want anyone. If you feel uncomfortable, you can still help, but you can't help in person. We don't want anyone to get sick or anything like that. We especially don't want the people that are coming to get assistance from us to get sick. Okay, I just put this on here to remind you for the CAC trainings. Those will come live August 28th. If you need help with those, I'm really good at them. I have to do it again for the agent. Being an agent, you have to do the trainings every year, but yeah, okay. And post-enrollment assistance, this is another new one. This is because me and Meryl are agents now. So I'll take on most of this because she's not paid. I'm not going to ask her to do a lot of it. But this is, if you think of it this way, like if someone signs up for Cigna, well, I'm the Cigna agent to them. So if they need help with finding a doctor, with medical bills, with anything like that, they no longer have to call Cigna. They can call me. And I have their portal. I can log on to the Cigna system, and it's really neat. I can get into all their resources and stuff like that. But we want our volunteers to do checkup with the consumers to make sure that they're done with the enrollment. Make sure they pay their bills, or the difference this year too is to pay their bill. I have found a glitch with Health Sherpa that we don't want them to call healthcare.gov to pay the bill, because when you do that, it takes me off being the acting agent, and we no longer get compensation for the work that you did. So they'll either call me to pay the bill or call the company directly to pay the bill. As a volunteer, you no longer have to upload the documents and stuff like that. I'm going to take on that responsibility for everybody. The only thing we're going to do is everyone's going to give your consumers my phone number, and we're going to say, please bear with us. Andrew will get in touch with you on the 16th of December and to get all this in, because I have the 16th till the end of the month to do all that. But then identifying doctors and helping with all of their insurance needs. And okay, so now I'm going to, how do I, bear with me 1 minute. Okay, stop share. And now I'm going to, okay, well, now we can, you can unmute yourself to talk if you have questions or anything like that.
A question.
Go ahead, Claire.
If we wind up enrolling people in TennCare during this period, I know our emphasis, will probably be on ACA, but can we go ahead and do the uploads of the documents and things like that?
Yeah, by no way am I trying to say you can't do any of that. I just don't want anyone that's volunteered to feel like they have to.
Okay.
I just want to make sure that everyone knows that they don't have to worry about feeling comfortable getting a text message or email and then uploading documents and stuff like that.
But you're talking about uploading TennCare documents in TennCare, not in Health Sherpa.
Either way, yeah. I mean, TennCare just goes along when I'm talking. I mean, everything I'm saying towards ACA just goes toward TennCare too. I'm going to try to get more volunteers to do TennCare enrollment this year to try to pull me off of TennCare some. I know it's impossible to take me completely off TennCare during open enrollment, but try to just have specialty cases come to me. But to have people that feel comfortable, if we can find people that feel comfortable doing TennCare Connect over the phone, it would be wonderful. And Meryl, I want Meryl to just do ACA.
The people in Chattanooga have been trained to do TennCare. Now, sometimes they need help, but they do TennCare on their own.
Anyone else have any questions right now? Tony?
Yeah. Well, actually, I had one, then I forgot it. But so just let me pass right now.
Yeah, but
Okay.
I have some questions.
Go ahead.
Go ahead.
I have a question that's kind of global in the sense that you said that they don't have to set up an account, they don't have a password.
Yep.
So I don't understand this. So if I don't have an account and I don't have a password and I have a change in income, or I get married,
They need to
or
call
I have
me.
to add a child, what do they do? Where do they go? Is this going to mean?
They call me. I am the acting agent for their life of their health insurance.
But you haven't set up the trust between you. They might call me because they trust me, they know me, but they don't know you.
Okay.
So I guess I'm just confused about the system.
If you don't feel comfortable doing it, you don't have to. And this
I
is just an
understand
option.
that, but it's still a system that the THCC is pushing, and I understand the financial benefit of pushing this system, but I'm still confused about the consumer, which is why we volunteer. So that's just a question. You don't have to answer it.
That's more of a statement. Here we go. Charles, the new Yes, it is the Insure All Tennessee hotline. That's what I'm calling it. Yeah. Because have you seen the new website that I made for it?
Mm-hmm.
Yeah. Because it's getting a lot of views. I've been plugging it on Facebook and stuff. We're getting I think we've had about 2,000 views in the past 3 weeks. So yeah, it's doing pretty well. Yeah. I mean, Madeline, I understand what you're saying, and it's just especially because it's all going to be phone now. Well, mostly all of it's going to be phone. That's something that we'll have to tackle later on, but it's nothing that I can think of. I mean, I'm going to have to be their acting agent. You're going to have to tell them if they need help, they need to reach out to me. I can resolve the issue, or they can call the insurance company to resolve the issue, or they can call healthcare.gov to resolve the issue. I mean, since it's not as person-to-person contact this year, you're not, unless it's people that you enrolled last year, you're not going to build that in-person relationship.
Andrew, do you know what it would take for any of the rest of us to be considered agents on behalf of Tennessee Healthcare Campaign?
Meryl, do you want to offer that, whether they'd want to do it?
Well, tell us what it is. I mean, everybody might have their own.
You have to do training, and you would have to do, I mean, it's a pretty extensive training you have to do. And then you have to do the CMS training to get certified that way. And then I would have to get you contracted with all the insurance companies. So, which that took me forever. But I mean, theoretically, if you wanted to do it, we could probably do it, make it possible. But I mean, that would take a dedication. I mean, Meryl's got it, but I don't know many people that would want to dedicate that much time towards it. When in reality, we're making the same money off you doing it off my account than if you created, you know, became an agent. So either way, we're going to make money.
Okay, I've got a question concerning training and getting recertified for as a CAC. So what you had put up earlier on your screen there, as far as CMS, there's a blackout period for if you want to be certified for this year. But then they basically said that after August 30th, you won't be able to do any training, and then they're going to put that training back online probably sometime in late September or early October.
They usually put it up about the 10th or 15th of September, and they make it active. They wait until they have the CAC, the navigator, and the agent trainings.
Okay, so
release them all at the same time.
Right, that's what I was trying to get an idea of, as far as when we can go back online to CMS to begin our training, our testing that we have to go through. And you know, in the years past, we've had to undergo, I think, 5 modules of training. Do you know if it's going to be those 5 again this year?
Yeah, it's the same ones.
Okay.
So what I've heard is that they're not going to have changed any of it.
Mm-hmm.
And are the CEUs 12 hours still required?
Mm-hmm.
Okay.
Yeah, and just one other question. I'm glad that was the question that I was going to ask earlier. I forgot. Last year, part of getting certified with CMS was also getting certified for the state of Tennessee. And some CACs never heard back from the state of Tennessee and never were assured and felt uncomfortable with helping with enrollment because they never heard back from the state of Tennessee that they had, you know, that they were approved by the state of Tennessee. I'm just wondering how that's going to work this year.
I honestly don't know, because that was JC's doing. I didn't handle any of that.
I can answer that, Andrew.
Okay, go ahead.
So Andy Spear and I have talked about this. I'm still the contact for the CMS on that effort. We are labeled at what's called a CDO, a Certified Designation Organization. And so all the CACs fall under Tennessee Healthcare's designation. And the challenge is, so you go through all the CMS training, you get your certificate, and when you got your certificate, you'll need to pass it to either Andy or me, and we'll sort of work that out. I'd like you to do it to both of us, and then we'll figure out together how we get that stuff to the state of Tennessee. Part of the problem last year was we didn't get set up in time with the State Department of Commerce and Insurance. And so we were delayed in getting going in our setup with them. We have to fill out a designation organization with the state of Tennessee. I've talked with Andy about that. He's looked at the video. He says he's going to do that now. So I think that will get set up, and we'll have a better path for being sure that the documents, which would include your certificate and your fingerprints, it comes to both of us, and then we'll get it to the state of Tennessee. And I think we can avoid that problem.
Are you saying we have to do fingerprints again?
I'm not certain about that.
I believe it's if you haven't had it done in 5 years. That's what I always thought it was.
They haven't changed in 5 years.
I had to have it done again because I've had so many different roles that perhaps that's part of the problem. But so if you were consistent with having it last year, you may avoid being able to do it again this year. So let me
Thank you, Jackie. Thank you.
bag off on that one for sure, Madeline.
Okay, thank you.
This is Rich, and I have a question. You talk about phone, and I realize that a lot of the people that will be helping, that's the way we're going to connect with them. Mm-hmm. But I've been surprised at how many people do have a cell phone and can do, some kind of online video calling, which I think is a little bit of a step up. Are you saying we don't want to get into that, or are you just?
Oh, I know what you're asking. Generally? Yeah. Let me explain one thing how I do it. When I'm doing a phone enrollment, I never show them the application. Because that's just, I mean, you're typing in socials, birthdays, everything. I never share my screen during that. But the good thing about Health Sherpa is you can go through the insurance plans first. You don't do it last. You can pick your plan before you do the actual application. So I share the screen while we're going through all the plans, and so they can look at it and really get into it. And then we pick a plan, then I unshare the screen and continue on with it. And then at the end, if they want to look back at the plan again, just, after everything's accounted into it, then I share the screen again. To me, it's just too much of a risk sharing the screen. I just hate the idea of, even these are protected now, but having a social and birthday, that's everything as somebody. So, that's me. I don't know if THCC is going to have a stance on that, but, it is sharing your screen is very useful when you're when you're trying to explain to someone.
You can't really do it without sharing your screen if you're picking a plan. It's because
people just tend to trust me when I'm just saying it, but when I can show them what it is, they really get a better.
They want you to pick it if they can't see it, and the only way that they can really pick it for themselves is if they can see it.
Exactly. But I'm gonna go through some. We have some phone trainings that you can sign up for, where I'm gonna go in and show you exactly how I do them, and let you guys kind of just see how I've been doing this for 7 years.
Right. I would appreciate it if when it's a little more clarity about the fingerprints, if the word could go out as to on that, because that takes some time. And I'm happy to do it. I'm not happy, but I will do it again. But I'd like to know if I have to do it again before the last minute, kind of.
Sure.
Or be waiting to hear back from the state and not hear and not hear and not hear, and then be said, oh, you have to do your fingerprints. That's why you didn't hear, when I'm already into helping people. So I'd like to try to avoid that scenario.
Andrew, I want to ask another question. Are you saying you're successful in getting people to select a plan or know what they want to do with it before they see what their discount is?
Yep, because you have at the beginning of it, you have an estimate of what their income's going to be. Now, I always tell them it's not going to be exact, but I tell them that we can have a ballpark of what it's going to be, because that's what we talk about first. When I very first start talking to them, we talk about income, and whenever we have a stable feel on it, we put that number in. It's just an estimate when you do it at the beginning. You're not saying this is what I definitely make. This is just what the estimate's going to be. And I tell them if we're wrong in this, it could go up, but it could also go down in your total cost.
So you do all the figuring of their income before you do anything else?
Yeah, it's just like when I first start talking to them, I say, okay, well, you're going to get help paying for this, but it's based on your income. So let's get a general idea of what your income is so we can go ahead and look at the plans and how much it's going to cost you. Because some people call and they're like, well, I don't even want to do it if it's going to cost so much money. So it's a good thing to have whenever you have people that say, if I'm going to spend more than $100 a month, I don't even want to do this. So I don't have to do a whole application to see how much it's going to be.
So what you're saying is Health Sherpa has a way of doing the estimating of seeing the plans, just like the marketplace does.
Yes, but yeah,
Okay.
but you don't have to. Yeah, but it's just the way on the marketplace is you do that, and then you have to go in and create an account and do all that. And with this, you don't have to do the create account stuff. It just makes it a whole lot quicker.
Okay.
But you'll definitely want to tune in to when I do the trainings on Health Sherpa. I've made a like 50-page slide on how to do everything, and I've been really specific in it all. So we're going to go through it all a couple times before open enrollment. And if you don't feel comfortable using Health Sherpa, because I know with you especially, you have some really difficult cases, you might feel more comfortable just using healthcare.gov. That's no skin off my teeth, you know. We know your work. I mean, the ultimate goal of our work is to help people. So we're not going to limit whether we can help people, whether we can make money off of it, because we're a nonprofit, you know.
Well, I think like Madeline, one of the things I know that the trust thing with immigrants is really extraordinary. And there are so many documents involved that I don't think I plan to do the immigrants through Health Sherpa, but I'm going to look at whether I can do some of the other folks who speak English easily through Health Sherpa, and see if I can figure out how to do that.
Sure, but by no ways did I mean that I want everyone to use Health Sherpa for everything. If you don't feel comfortable using Health Sherpa to do anything, that's fine too. I'm not out to just make a profit. Our goal is to help people. The making the profit is just for something we're doing. We're getting paid to do this so we can keep me. But
well,
yeah, it's a benefit of it.
I think for me, the way to address what Madeline was saying, and I feel somewhat the same about that trust level, because when we're doing it all by phone, they have to trust us. So the question is, do they get to the point of trusting us enough where we say, we have a mechanism where we can do it through a person who is associated with us, who is an agent, so the organization can receive a bit of money for the service that we're providing as volunteers. Are you willing to do that? And we get their agreement that that's okay. And then I think that opens up the possibility that, because several of them offer anyway, they'd like to pay for what we're doing. And we say, this is not going to any one of us, but it does help the organization.
Exactly.
So
what I'll do is I'll write that statement in the phone consent statement. Thank you for the idea, because I do need to put that in there, because I have a statement that you're going to say if you're doing phone enrollments that you say before you actually do the enrollment. I'll make sure I include that in the updated version of it. And,
Madeline, does that address some of what you're talking about?
I think it could. I'm just, I'm not anti anything. I'm just trying to understand how it all goes together. Like, do they get an eligibility letter? Do they get a number with healthcare.gov? Is healthcare.gov, if they can't get a hold of you, can they call healthcare.gov directly? What will will they have an application number to use? I mean, there are all those little pieces that we finally have got streamlined. And so I know those pieces, but I don't know Health Sherpa pieces.
Health Sherpa works alongside healthcare.gov. They both go into the same system. So like when I do an appointment on Health Sherpa, I get the same eligibility notice as you would get if you did it on healthcare.gov.
And do they get a mailed version as well?
Yes, they get the same thing in the mail, and all their mail will come from healthcare.gov, not Health Sherpa. Health Sherpa is just a third party little system into it.
You were around in the early years when we
Mhm.
used to do the big enrollments down at the library.
Uh-huh.
And I believe it was the second year, could have been the third, but it wasn't the first, where the insurance agents had their separate room and they were able to knock out more enrollments than we in the larger room.
Uh-huh.
And I was told by one of the family and children service people that it was because they had a portal and could get in the back door. Is Health Sherpa
No.
like a portal going in the back door?
It is in a way, but it's not the same thing that I know what they were using, because as an agent, I can use that too, but you can only use those for individual insurance companies. What Health Sherpa is you still see all the plans and all that. It's just a very simplified version of the application. It's a whole lot easier to do. And I think to answer everyone's question, just make sure you tune into my webinar when I do the introduction to Health Sherpa, because you'll get all your answers. And I know the concerns, because I was concerned about it at first, but I've done about 12 enrollments off of it in the past couple months, and they go so quick, and my consumers love it because it's not as much, it just seems quicker and more fluid, and everyone seems to like the getting the insurance plan at the beginning. Everyone, because they have that idea of what they're going to get before they do the application, and everyone I've talked to seems to love it.
I have just one pointed question about Health Sherpa. Can you enroll in TennCare through Health Sherpa?
Yes, but it's just like using healthcare.gov to enroll in TennCare. They're asking us not to do it, and you shouldn't do it. It tends to take a really long time to get your TennCare cards if you qualify, but yeah, it will still get sent to the Medicaid office.
I'm going to strongly suggest we don't do that, because the people at TennCare really do look at the application stuff that we submit. And because we have to submit so many more documents on TennCare than you do on healthcare.gov, it just delays the process.
That's what I meant, but I didn't want people to feel complete. I don't know. He asked the question, so yeah, it does still go there. But yeah,
if you're not comfortable doing the TennCare Connect, that's one thing. But I'd like more people to get comfortable with that if they think they're going to do several TennCare applications.
And we would love people to be willing to do TennCare applications this year.
Yeah.
So.
The advantage, Rich, is that both Andrew and I have connections with the people at healthcare. So if we run into a situation that seems obnoxious or a serious problem, if you write the nature of the problem in an email, we can send it to the individuals there. We get immediate answers. They take a look. If there's some confusion about documents, we can attach the documents to our email. They get it directly. And so they are problem solving with us. And Andrew and I have seen many, many situations resolved much more quickly.
Oh yeah, almost all of mine are resolved in 48 hours. Go ahead, Claire.
We could always do an extra training on TennCare Connect too. Wouldn't that be possible if people?
We certainly could. Yeah.
If someone else would want to do that, I would greatly appreciate it.
I'll do that.
Okay, that would be wonderful. I just got so many I'm doing. I don't want to add another one to it.
I'd also like to mention that there's a whole series of Beyond the Basics. And so if people want to review some of those, I just think their review, especially of some of the more complicated things, the issues about immigrants and data matching and just the updates are very, very useful. And since you have to get 12 hours anyway, this helps you get the 12 hours for the certification for a CAC. If you're not interested in the certification, maybe you don't need that, but it sure does make a difference if you feel more confident about the current level of how things are working. I would also say to you that currently healthcare.gov has had so many changes in the last couple of months. Right now, they're pushing as hard as they can, getting people to select HRA plans.
Yep.
I have a question.
Go ahead.
For Jackie. How do you get to Beyond the Basics?
I'll send you an email. if anybody else wants that, speak up and I'll take notes of who needs it.
Well,
Because they just sent an email out with which points to their website where they have both prior ones and the current set they're doing. And the advantage of that, again, is working toward the 12 hours. Now, I think some of Andrew's webinars would count toward the 12 hours. But if you need 12 hours, that's a good way to get them.
And I was going to say that that's done by the Center for Budget and Policy Priority, and they have a very good reputation. They've been involved with healthcare.gov and Families USA and everybody else since the very beginning. So you're right, Jackie, they're very good trainings. I've got two questions, and actually they might go to you, Jackie, or Andrew, just whoever. You know, Jackie, you have coordinated some events with the Tennessee Hospital Association concerning the insurers, as far as getting more information about the plans of the insurers. So that's one question, if that's going to happen again.
I feel certain it is.
Yeah, and so is that something you're going to do, and we can hear from you as far as?
Yeah, I'll plan to do it with Gwen Walters. For those of you who may be not so familiar with what we've done in the past, we have a 1 hour segment, 20 minutes of presentation, the rest of the time questions with each of the carriers that are going to be in Tennessee. And so you'll get an email to sign up for those sessions. And they work very well because you're talking directly to a representative of the insurance company, and they give us contact information because they really like the idea of talking to people like us. And then I find over the course of the year, I've referenced several of them a couple of times to solve consumer problems. And that's very helpful. So we'll send it out to all the people that are on this list so that any of you may want to hear. And you only have to listen to the ones you're interested in. So, you know, if you're in a certain area of Tennessee, we'll let you know which carriers are in your area.
And I think you probably know that Gwen Walters, Gwen Walters has retired, so she's no longer with the Hospital Association. But the other question I had was...
we'll figure that out.
Yeah. The other question is the Department of Commerce and Insurance also had a meeting that was at the Department of Commerce and Insurance, sort of as an introductory meeting. Do you know whether or not that's going to happen again?
I'm sure it's going to happen again. The Department of Commerce and Insurance brings all of the carriers together in one meeting. They tend to go over things rather quickly, but the slide presentations that they do are then available to everyone, and it gives a lot of information. Again, not necessarily the right contact person, but very good comparable information, and there's also an opportunity to ask questions. You get a chance to ask a few more questions by the individual ones we do, and you only have to listen to the ones that are of interest to you. But I feel certain that the Hospital Association will want to do it again, and I'll figure out with Gwen how we might do that this year. She's the one all those folks know, and so I'm sure that's been turned over to somebody.
One more quick thing I wanted to add that's going to be new this year is that me and Meryl can now enroll our clients into a, like, let's say they pick a Cigna plan. Well, me and her can enroll them in a dental plan that will coincide with their account. So I'll have to show Meryl how to do this, and I'm working on getting us contract. I didn't realize we have to get contracted with the teeth insurance, but it's a real easy process. But we're going to be able to, like, if they sign up for a Blue Cross Blue Shield, because we're going to get contracted with Blue Cross Blue Shield, Cigna, and they want to add dental to it, and they don't find one on, you know, you can do the find dental thing. If they just want to get one with their insurance company that they picked with the plan, we can now do that. And we can actually sell dental insurance for throughout the year, and it's not, they don't have to sign up at a specific time. But dental will be a whole new thing for us.
I want to go back to the volunteers who may be doing some of the phone and the follow-up calls to
Yeah,
encourage.
I'm gonna have presentations on the volunteer stuff. I didn't want to, this was just kind of a broad view of what all we're gonna be
Okay.
doing. I'm gonna have the volunteer webinars for just those specific things, so we can go through each volunteer group, which one you want to enter, and I'll go over all the basics of what you're gonna do in each of those, and everybody can add little details to it as we go with that.
I just wanted to make the point that asking people to be prepared to talk about their income and to think about what they earned in the last week, the last month, and if it was any different in prior months would be very, very helpful.
Okay. The rest.
I've got something that's entirely social, has nothing to do with all this stuff.
Go ahead.
But Joe Marcus, who is new to me and is probably new to most of us, is from North Carolina. And when I worked with Enroll America, I worked with folks in North Carolina, and the connector that we're going to be using, the original version of the connector came out of North Carolina. Anyway, I was just wondering if Joe Marcus could share with us a little bit more about what you did in North Carolina and who you worked with there.
Sure. And I was not aware that the connector had come out of North Carolina. I was a volunteer with an organization called Pisgah Legal Services out of Asheville. And we worked at a state level under the umbrella of Legal Aid of North Carolina. But Pisgah Legal is it's a legal services firm, serves an underserved community, completely funded by grants and private donations. But when Obamacare first became available to the public, made a commitment as an organization to what they term health justice. And so it's kind of a two-pronged thing. And the part I was involved in was what we're talking about here, enrolling people only in the Affordable Care Act. Much like Tennessee, North Carolina has not expanded Medicaid. And so Pisgah Legal has staff, actually one of their managing attorneys, is really involved in trying to get the appropriate legislation passed. But we as volunteers never did any enrollment into Medicaid. That was just something that our Department of Social Services did. So this concept of enrolling people in TennCare is completely new to me. And it's just been about a year ago that I moved here. And as y'all know, things are done a little bit differently in Chattanooga. I certainly found that. And the emphasis here seems to be much more on TennCare than the Affordable Care Act. So I didn't get a chance to do a lot. I think we need to do some more care, but that's not the question you asked me. North Carolina was one of the leading states. If you look at numbers for ever since the inception of Obamacare, they always did a really, really good job of outreach, getting out to people, not just in Western North Carolina where I was, but across the state. Getting out to people and getting people to enroll, making it easier for people to enroll in the Affordable Care Act.
I can't remember the name of the state director, but you're right. North Carolina was a leader, especially in outreach. Yeah.
Yeah, I don't know the folks from Legal Aid. The managing attorney at Pisgah Legal Services was another Jackie. And now her last name escapes me because you asked me. But anyway, so Pisgah had put a big effort into it, but I don't know the folks at the state level. But anyway, they did a good job. They continue to do a good job. I'm still in touch with those folks. If I have questions, and we're friends. I mean, and I assume you all do this too, that, we would get together and do some socializing too. I actually did not work out of the Asheville office. I lived about 50 miles out of Asheville. So my work was primarily in rural Polk and Rutherford counties, which doesn't mean anything to y'all, but of the counties that people mentioned, the only one with which I'm a little bit familiar is Sevier County. And, I kind of know where that is, and I'm betting there are people who live in the hollers, and that's the kind of folks that I worked with a lot. So it was an interesting thing. So coming into a city like Chattanooga is a different experience for me too. But I bring to it, like I say, a lot of experience with the marketplace. So it's pretty focused like that. And so I hope I can do something with that here in Tennessee.
All right, thank you.
Any best practices I have, I'm glad to share that we did. Of course, this whole doing stuff on the phone is a brand new world, and we're all doing that for the first time.
Thank you, Joe. Appreciate that.
Mm-hmm.
Okay, well, there is just a little bit more to my PowerPoint I'll bring up. We can just go through it real quick, just a second. And I'm going to move this again. Of course, it's not going to work. All right. All right. Okay, phone enrollment assistance. It says it's not that hard. Again, I could be saying that because I've been doing it for 7 years, a lot of it over the phone. But we'll go through it. I want to make sure that you feel comfortable. We don't want anybody doing it over the phone that doesn't feel comfortable doing it. So I'll try to go through. I only have 2 scheduled trainings on Health Sherpa and 2 for phone enrollments, but I will do individually if you want. Because some people that are going to be doing more enrollment, they might want to just have an hour set aside with me to go through it. Again, the Health Sherpa does not require a password verification like healthcare.gov. Applications take less time to complete. The consumer previews health insurance plans before beginning the application process. In this, you will not need to worry about uploading documents because I will do all that. And if you have questions or concerns, you can always call me. You no longer have to call healthcare.gov because you won't have to do a password reset or anything like that. But if you just have a general question about their account, I can also get into their account and look over it all, even if I didn't do the application. This just shows some of the benefits. And as of carriers, right now, I think I already said, we are with Cigna, Bright Health, Oscar. Ambetter won't let us do it because Ambetter won't license with an insurance agency. They will license with individual agents, but that doesn't, I don't want to just get paid from them. We want the money to go to the healthcare campaign. So they're in Blue Cross Blue Shield, I figured out a way to do it. I'm hoping it works because if we can get them, just not having Ambetter won't be that big a deal. And we'll still, the one good thing about Health Sherpa too, is all the enrollments we do for Ambetter, we'll still get $50 for each enrollment of, each one that you do. We'll get, because Health Sherpa gives us $50 for each insurance agency we enroll in that we're not appointed with, because Health Sherpa isn't appointed with everybody. So they give us $50 for that. So like, let's say we do like 10 people get a Health Sherpa or Ambetter account. Well, we'll get $500. That's better than nothing. So it's a good little thing to have. Okay, we've kind of went through all this. And again, I'm going to send out this PDF where we'll talk about. Do you guys want to talk a little bit about does anyone have any ideas on how we're going to do outreach now with COVID? Does anybody have a unique idea on how to reach people besides social media for outreach?
Is there a little bit of money to put into some digital ads?
Yeah.
I know when Walter did that, that was one of the best things we did.
I've made about $500 off Health Sherpa, and we're going to use that money to use social ads and stuff like that. But if we can get the big grant from the state, then we'll have some more money. But there is some money set aside for advertising and stuff.
I don't know if it will be different in the open enrollment period, but right now, healthcare.gov is not allowing the C plans option to preview the shop before you get involved in doing it. And I don't know whether that is a planned thing or not, they are pushing people to use insurance agents.
Yeah. I don't know. You can still preview plans on healthcare.gov. All you gotta do is type preview plans in the search.
It doesn't work right now.
I just did it today.
Preview plans, is that what you typed in?
Uh-huh.
You used to type in C plans.
Oh, no, you just preview, because that's what the thing comes up as. But
Okay.
yeah, you can try that next time. If that doesn't work, let me know, because Health Sherpa, you can definitely do that.
You're right, that works. Thank you.
You're welcome.
Okay, just you know, the idea that my wife had many, many years ago, as far as outreach, which I think was probably pretty effective. Of course, she really worked on building relationships with folks, and this is when we were doing enrollment face to face. And I think several people indicated that people really appreciated what we were offering, and they wanted to help. They wanted to. You know, they'd asked us if they could provide any payment to us or anything like that.
Sure.
And we said, no, we do this as a volunteer. But what Madeline would always say, well, this, excuse me, well, this sort of is a payment, but the payment is this: we want you to tell 5 people about what we do and tell 5 people about the 844 number. And,
Sure.
and actually, I think some people took her up on that, where, you know, they spread the word that, you know, if you need to get enrolled, call 444 and you,
844.
excuse me, 844, and they'll connect you with a CAC enroller. So anyway.
She corrected you quick on that, Tony. It's
Yes,
844. No, I love that she did that. And especially now, because we really do benefit off enrolling them. And then if they can provide us with somebody else and we can enroll them, we can make more money to do it. And I hate to sound like that, but because I know we're a nonprofit, and I'm not trying to say we're trying to make a profit, but we're trying to make it so me and hopefully we can hire on somebody else to help with this.
Well, and people need to understand, and I think we got to be careful about how we talk about this, because people need to understand that they're not paying more because of, and we're actually not getting a profit. We're getting
compensation.
We're getting compensated, and we're receiving that, and you don't get a commission, Andrew. You get paid a salary, so you know, you have no incentives to, you know, enrolling 2,000 people or whatever. So
exactly.
So I think we got to be careful about talking about that and how we talk about it. But but people do appreciate what we do and the services we as volunteers do, and we're happy to see that the healthcare campaign gets some compensation for its work. So
because it helps us grow our work. And the whole idea that JC had of this was to help us with this work, to build it. And as of what I'm doing now, I mean, it looks like we're going to be able to really build on this as long as we can get everybody on the same page.
And just let me finish here. One other thing, you know, the healthcare campaign is not the only nonprofit organization who has gone down this road. This idea was initiated by the Palmetto Project, which is in South Carolina. It's a nonprofit organization. They were the lead navigator group for South Carolina. And they also struggle with how do we continue our work and continue their enrollment activities. And they have a wonderful program down there. And they were able to work out something with, it's not called Health Sherpa, but it's something different, where many of their navigators are still navigators, but they're also agents.
Yeah, and Music Health Alliance in Nashville does this too. Because what Nikki is with them, and she's an agent, and they do the same exact, because me and her are kind of learning all this at the same time. But again, in the PDF, when you get to these screens, all you got to do is click on it and you can sign up for each one of these trainings. And if I have more trainings, I'll send you another notice out for different things. But feel free to register for anyone that you want. The ones that, like, say volunteer training, I'll go over basically the same thing. It's just at 2 different times. So, because some people can get on in the morning, some people can get on at night. So I just want to make sure that everybody could. Go ahead, Claire.
Just a quick question about the connector. Will we be using the connector just for our own networks enrollers, or will we be, getting like the FQHCs to put their enrollment times in there too? I just wasn't sure how we were going to use
this year. The connector's just free. I had built this whole new system we were going to use, and I'm still going to use it for my phone appointments because I just like it better. But basically, we have the connector. It's there if you want to use it. It's free. We want everyone else that's on with us, the FQHCs and stuff, they can still use it. It's just after I told them I didn't want it and I showed them the new system I built, they just offered it to us for another year for free.
Really?
So we can't. I was never going to say no to it.
Well, do we need to do outreach to these other places to get them on the connector, or how does that work?
It basically, if they were on it last year, they'll be able to still log in. So
okay.
Yeah, and whoever, what's his name, Fallon, because he's the one who I've been talking to about this, and he's let everybody know that I agreed to another year. So I don't even think many of them still use it though.
Okay.
Just let me say one thing. For those of you who are reluctant about the telephone arrangement, it's probably many of you know, I did this for years without doing any telephone up until March the 8th with COVID. And I've now converted completely to telephone. It takes a little longer, but you can build the same trust, and people work just as well. I have them text me or email their documents. That work is actually more efficient than when I was doing it in person, because they rarely had everything with them when they showed up. So it is possible. And I think people in this time are also more comfortable with doing this by phone than doing it in person.
That's a good
So
point.
I don't think we're going to have any difficulty developing the trust level. It's how you talk to folks that builds that trust level, not just seeing your eyes. And I find even with immigrants, I have done some of these like Swahili and Spanish, just using a Google translator, and I just keep going back and forth.
Wow.
It takes a little longer, but it is absolutely doable.
Wow.
You're using my Google text, the type. Yeah, I know what you do.
Yeah,
I've been doing that. I've been doing that for years, and it does take a little bit longer, but you can get it done. Any more questions?
Outreach. Wait a minute, Andrew, just for outreach, I know in Nashville, the public libraries are not open yet, but they will, they've got somebody that worked with individuals through Family and Children's Services. They will put on their screens any information you send them about 844, and so that is one place, and then people can see it when they go to the websites. So that's the only idea I have. I don't know how this is just complicated working as a pandemic out OE, but we'll get it done. It's going to also be very challenging to ask people to predict their incomes for 2021.
Yep.
And I think we've got to think seriously about how to do that, because I don't think you can predict your income for tomorrow these days, much less for a year.
That's why we want to make sure they all have my phone number. So that way, if they do realize in a couple months, because I can talk them through that. If they realize in March or something that they're not really going to make that much, or they're going to make more, we want them to be able to just call me and talk through it.
Well, I've also developed some very clear strategies about how to do that, because I've done so many self-enrollment, self-employed people who don't know. And it is possible to develop a scheme of how you do that. You need to use the preview of the plans to get a sense of plus or minus how much income, but then you got a range of what the cost is going to be, and you adjust the premium. And instead of taking the full discount, you take part of it. And you make sure with the part that you're taking, they're comfortable with what they're doing. And then you talk to them about what the cost difference will be if their income goes up to a higher level, and then how much they'd have to pay back. So then we talk about how you do that, how you set that money aside. And if they want to have another conversation 6 months from now, they can do that and we'll recalculate it. And I think we'll have to do that with many more people. But I'm glad to talk through how to do that in some detail with some examples.
That'd be great.
Yeah, thank you. I mean, I think the thing that I've learned something from every navigator and every CAC. In other words, we all have different things that we sort of do well, and we've learned from others. So I think the more the merrier.
From the beginning, our community outreach to help each other, help the consumers has always been one of the strengths, I think, of what we've done. And it's very much appreciated.
All right, well, I will send out the PDF to everybody. Sign up for any classes you want. You'll have my email. If you got questions, just send me an email. My phone number's on it too. But thank you for coming, and peace out, yo. Peace out.
Thank you.
Thanks.
Thanks,
Thank you,
Andrew.
Jonathan. I hope you get
Look
your
forward to working with everybody.
What'd you say, Tony?
hoping Jonathan can get his speaker working.
Oh, yeah.
His microphone working.
Peace out, bro.